Hi, I'm Kendra with Denali Benefits, and if you're new to Medicare or if you're trying to sort out your options, you're probably going to ask yourself, if you haven't already, should I choose a Medicare Advantage plan or a Medicare Supplement plan with Part D? Today, I'm going to talk about the key differences between these two paths so that you can determine which one best fits you and your situation. Let's start with Medicare Supplement plans, which are also called Medigap plans, plus a standalone Part D prescription drug plan. A supplement plan helps to pay the costs that original Medicare or Parts A and B doesn't cover, like copays, coinsurance, and deductibles. Then you would add a separate Part D plan to cover prescriptions. So who is this a good combination for, or who does this fit best? First, for people who travel a lot. Now, if you are often on the road across the US or internationally, Medigap plans give you the freedom to see any doctor or hospital in the country that accepts Medicare. There are no network restrictions, and some plans, like Plan G or Plan N, even include limited foreign travel emergency coverage, which is up to $50,000 in lifetime benefits after paying a $250 deductible. Second, for people who want to choose their doctors. With Medigap, you don't have to stay in network, so you can see any Medicare provider anywhere in the US, and usually you can do it without even needing a referral. So the flexibility is a pretty big deal, especially if you split your time between states or if you want to keep seeing a specific doctor or other provider. Third, for people who prefer predictable costs. Now, supplement plans typically have higher monthly premiums than Medicare Advantage plans, but they offer lower and more predictable out-of-pocket costs throughout the year. Now, this can really give you peace of mind if you use a lot of care or you just don't like surprises and you want to avoid them. Now, let's talk about Medicare Advantage, which is also known as Medicare Part C. These are all-in-one plans that bundle Medicare Part A and Part B, and then they'll often include Part D in that bundle as well. Some are also going to offer extra benefits like dental, vision, hearing, and gym memberships, and Medicare Advantage you might find to be a good option for you if you're more budget conscious, if you're okay with, or maybe you even prefer staying inside of a particular provider network, or if getting those added benefits is really important to you. So we're gonna break down each of those scenarios a little bit more. First, if you tend to be more budget conscious, these plans usually have lower monthly premiums. Sometimes they're even as low as $0 per month. But it's really important to remember that you'll still pay co-pays and co-insurance when you use services, and those costs can really add up. Now, most plans are going to have a maximum out-of-pocket limit, which is going to help to cap your annual expenses, and that'll help with budget. Second, people who are okay with using a provider network. Now, unlike Medigap, Medicare Advantage plans are usually going to require you to use doctors and hospitals that are within the plan's network. And you might also end up needing referrals in order to see a specialist. But if you're okay with that structure, or maybe you even prefer the predictability of it, then this can work just fine for you. And third, for people who want those extra benefits we talked about earlier. Now, many Advantage plans are going to offer things that original Medicare and supplement plans don't offer, like dental, vision, hearing aids, fitness memberships, over-the-counter benefits. And if those are things that are important to you, then that could really tip the scales on what you choose. So how do you decide? Now, if you want maximum provider flexibility, if you travel often and you value predictable costs, then the Medicare Supplement Part D combo might be your best bet. But if you want to keep your monthly premiums low, if you don't mind working within a network and you want extra benefits, then a Medicare Advantage plan could be the better choice for you. So the thing is, there's no one-size-fits-all answer. It's going to come down to your health, your budget, and what kind of experience you want with your healthcare. Now, if you need help comparing your options, Denali Benefits is here to help you. We actually specialize in helping people to make confident Medicare decisions that match their real-life needs. So you can click the link in the description box below in order to schedule a free consultation with us, and we will work with you on that. Now, if you found this video helpful, please like and subscribe and hit that bell so that you don't miss future Medicare tips. Thank you so much for watching, and I will see you in the next video.